So this will be liposuction of the inner knees, and this is somewhat of a tricky area. The fat can be very soft and can come out very rapidly, and if you don't be careful, you can remove a great deal more than you want. Dr. Sattler will point out that this most inferior incision on the knee, where the cannula has been inserted, is the most important incision on the knee, because this then is, since it's dependent, allows the tumescent fluid to drain afterwards. And we want to have a couple of inferior incisions if possible, so that we can have a little crisscrossing of these vertically oriented tunnels.
There's another crucial point at the inner part of the knee. It's the epicondylus medialis as a bonial counterpart, which can influence the fat removal and can result in an over-resection just above that epicondylus. So when the patient is, like as seen here, stretched out and tense the muscles, then this can be prohibited. As you can see here now, how the patient can move, you have different accesses to the dorsal part and also the frontal part in this respect, as we crisscross in a different way.
So in this patient, we're suctioning the medial knees, and we'll also do the medial thigh and the area in between. And this creates one single wound, which then contracts symmetrically in hopes of giving a very smooth surface to the entire inner thigh. If you just treat the inner knee and the upper inner thigh without treating the intervening area, then the patient can have some irregularities postoperatively that they'll complain about.
Yeah. As you have seen, positioning is not always so easy, but having the right position gives you the guarantee of not having any irregularities due to the tension of the skin in order to the fat tissue, which is soft and can be, when skin is under tension, be excessively removed.
So we'll do some fairly extensive liposuction of the knee area and also the upper inner thigh, but the intervening area will be suctioned much less aggressively because there's not as much fat there that needs to be removed. We just want that area to blend with the other two areas. And then you see always the multiple hands in the field stabilizing the tissue.
Yeah. Although the tissue is moving a little bit, if it wouldn't be stabilized, it would hardly be possible to predictably remove the correct amount of fat.
So this, the left hand of the surgeon is always pinching and always feeling for the thickness of the skin. And Gerhard, we should talk about the endpoints that really separate the beginning liposuction surgeon from the more advanced, experienced liposuction surgeon. And one of the endpoints is the pinch, the manual endpoint, touching the skin with the fingers, pinching the skin, and using that as a guide to the thickness that you're trying to achieve. Other endpoints would be the visual endpoint, how it looks to you, how it looks to the nurse, how it looks to your co-surgeon. Other endpoints would be the volume that you expect to take out. Usually you want it to be about the same on both sides. If you begin to get some blood in the bottle, that would be a sign that you're getting to the end of the case. And time would be another endpoint. You want to spend about the same amount of time in each area, and that's pretty much it in terms of endpoints.
Yes, maybe sometimes when the patient feels excessive pain, we would also need to stop the surgery.
That's true, because you're getting down close to the muscle, the area that's not anesthetized, and that means the case is finished.
Also, it's good to have quite a bit of control about the amount you have removed. And due to the experience you gather over time, you know how to expect approximately how much you have removed. And then there are cases with easy fat removal, and you see suddenly 400, 500 cc's in a case where you normally would only remove 300, you have to follow that and watch that carefully, then you know that you have to stop.
And another way of saying that would be when Dr. Sattler looks at the patient preoperatively, he knows that he's going to take about 500 cc's of fat from each hip. And so when he does one hip, does the other hip, he wants things to be fairly symmetric. So that volume in the bottle becomes another endpoint.